Now we're going to talk about evaluations and assessments. This is part of IDEA principle number 2. In the 1970s, there were a lot of issues with identifying students for special education. There was test bias, which led to a disproportionate number of students of color being identified for special education services. So this led to an examination of the assessments that we were using to figure out if students needed special education support. So what this led to was a mandate that we needed to use non-discriminatory evaluations. The issue with a lot of the assessments in the 1970s was that they were normed on white middle-class students. And so they weren't really appropriate to use with students from high poverty backgrounds or students of color. So in terms of non-discriminatory evaluations, we must use assessments that are valid, meaning they're assessing what they were meant to assess. We have to be careful in our test selection when we're working with students of color, and we also have to know how to interpret those tests properly. So that leads to a lot of expertise on the part of the teacher and the school psychologist when you're assessing students. The reason this is such a problem is because when you misclassify students, there is a huge problem. There are not good outcomes for students that are misidentified for special education. Being placed in special education can be stigmatizing for students. It leads to social isolation. There are oftentimes, there have been found to be lowered expectations placed on these students. And a lot of times these students, their school outcomes are not good because it ends up being a self-fulfilling prophecy. They give up on academic work because they were misplaced in special education. So now to prevent this, what we look for is a comprehensive, non-discriminatory evaluation when we're deciding eligibility for special education services. Traditionally, our assessments were driven by classification and eligibility requirements. So we were looking at how the student qualified for special education and if they qualified. And so we would use IQ tests and achievement tests to do that. And based on those results, we would decide if the student needed services or not, based on the discrepancy model, meaning their IQ had to be average to above average, and then their test score on the achievement test had to be 14 points lower than that to qualify for services. In terms of making it a more comprehensive assessment today, what should be happening in most schools is a balance of the traditional method as well as authentic methods. Authentic methods of assessment are driven by instructional needs of the student and planning for the teacher. And what we use to do this, we use response to intervention data, or RTI data. We also look at the student's present levels of performance. And when we put these two pieces together, the traditional and the authentic, what we get is a comprehensive evaluation of that student. So the framework for non-discriminatory evaluation, we have a clear purpose for evaluating a student. We know what we're looking for or what that student is struggling with. We have authentic procedures, meaning we're using those valid, reliable assessments. We have to consider the student's language proficiency. If a student is an English language learner, we have to assess them in their primary language. And this is easy most times to do with a student who is, say, a Spanish speaker. It gets a little more difficult when we might be dealing with a student whose primary language is Arabic or Russian. That's a little tougher. But you, as the special education teacher, the school psychologist, you have to be able to find an interpreter who can give that student that test in their primary language so that you can have the English results along with their primary language results. We also have to make sure the student has had good opportunities for learning. And this is part of what the response to intervention model is supposed to help with. We have to make sure that student has had good teachers, has had good instruction before we can say that they truly have, say, a learning disability. We have to take cultural and linguistic factors into consideration, and part of that is that culturally responsive teaching piece that we're going to look at next. But there are cultural factors that may influence a student's interaction with their peers, may affect a student's interaction with their teacher. And we have to take that into consideration when we're thinking about qualifying a student for services. And we also have to make sure that we're doing an evaluation with multiple measures, meaning we're using lots of different tests, that comprehensive piece. We're not looking at one test and determining whether a student needs special education from that. So if we're looking at a pre-placement evaluation, meaning a pre-placement in special education, we're trying to determine whether a student needs special education services, and this is most often for a student with a learning disability, or if you're looking at with a student that might have a developmental delay or an intellectual disability. You must have parent consent. You may not ever assess a student without parent consent. There is an evaluation timeline you have to sign, or you have to follow. Once the parent has signed the parent consent, you have 60 days to complete the assessment. And it is 60 calendar days, and the only time you stop the clock is over summer break. And the evaluation materials, you have to make sure the people giving the tests and the assessments are qualified to do so. And you have to make sure they're comprehensive, meaning more than one. And you do not have to there's an unreasonable request piece, meaning if a parent makes an unreasonable request, you can still move ahead with the assessment while you work out that unreasonable request piece of the parent. And that would be something that the district would step in and handle. It would not be on the special education teacher's shoulders to do so. The evaluation team consists of the parents, who are going to be giving you lots of background information on the student. It is required to include one general education teacher that knows the student, one special education teacher that's doing the achievement testing portion, a representative of the local education agency, meaning probably your district representative. It can be an administrator generally. A member who can interpret the assessment results. That would be your school psychologist. If you're doing occupational therapy assessments, it would be the occupational therapist. You, as a special education teacher, may not ever interpret IQ testing for a parent or for the evaluation team. It can be other individuals. It can be an assistive PE person, a specialist who has done some assessments with the student. Anyone that's worked with the student should be part of the evaluation team. And the child, when appropriate. There's no reason that an older child can't participate and discuss their strengths and weaknesses as part of an evaluation team. So the IEP team's responsibilities are to review the data, look at the student's present levels of performance, otherwise known as PLOPs, and determine, does the student have a disability, and does the student need special education, and if so, do we need to change the student's current program? There's also an issue of independent education evaluations. This is when a parent seeks an outside party to assess their student to determine if, say, a learning disability exists. And this can be done because either number one, the parent went and did it on their own accord, or number two, the parent didn't agree with the district's assessment, and so they went out and sought their own. They can request that the district reimburse them for this, and generally the district would have to do that if there was evidence that the student needed some sort of special education support. After that initial evaluation, we must reevaluate students every 3 years. So you go through the whole evaluation cycle every 3 years, and that's known as a triennial assessment. Other assessments and evaluations we have to consider are minimum competency testing, and those are otherwise known as like the high school exit exam, which right now the contract with the KC test administrator has run out, so that's been put on hold for this year for high school students. You can have specialized medical assessments that a medical team has to be involved with the evaluation IEP team. You can have assistive technology evaluations for a student. And then you can also have state and district-wide assessments that most districts have also. This can include district benchmark testing, Common Core testing, And also, if a student is not able to work to Common Core standards, you can have alternative assessment, which in California is known as CAA, and only 1% of the students can take this test. So in terms of IDEA requirements for students taking assessments, IDEA requires that all students are included in assessments with accommodations that are listed in their IEP if needed, and all data on these students must be reported to the state and the federal government. The state, the district, and or the LEA, the local education agency, determines accommodation guidelines, and there has to be an alternative assessment offered to students, which in California again is called the CAA, and it must include challenging academic achievement standards for those students that have the most severe disabilities. The two assessments that we use in the state of California, we have the SBAC, or the Smarter Balanced Assessment Consortium. That is what most students are going to take, and they can have accommodations and modifications given to them that are written into their IEPs. And then we have the California Alternative Assessment, which is in its second pilot year this year, and that assessment is based on alternative standards. And that's it for evaluations and assessments. Next, you can go ahead and do culturally relevant teaching.